People come to Turning Point who are struggling with the disease of addiction, and we provide a controlled environment for them to learn the skills they need to avoid substance use in the future. If they don't have access to medical care and they don't have medical insurance, we need to start exploring options that may help them out in that department. CMAR Turning Point is near and dear to my heart because 6 years ago I was a patient here. And through hard work and going to college and getting myself back on track, I've been able to elevate myself to a counselor, and now I'm clinical supervisor.
The need for behavioral health workers is so significant. It's actually quite dire. And so we have to figure out a way to get more people into the field. We decided to really focus energy on building behavioral health apprenticeship programs.
I, in my journey, had to leave work to go to classes throughout the day. I had to get permission to leave. I had to work on all my homework at night. This internship and the resources that are available are making it easier than ever to get involved.
The biggest challenge is just the pay. It has been increasingly difficult to recruit and to retain people in behavioral health, even though a lot of folks are very dedicated.
The apprenticeship program really opens the door. Employees are getting paid while they learn. And at the same time, the employer gets to have somebody on staff who's really learning the greatest depth and breadth of knowledge, because they're not just working on the job, but they're also going to school to learn all the theory behind what they're practicing.
Currently, we have 7 staff members who are doing the apprenticeship program. And what we're really trying to do is develop people. Good employees or employees who are really in tune to client care are seeing this as an investment.
I said, what I want to do is I want to be a counselor. They offered me a chance to go to school and gain all the skills that I would need to be successful in this field, and I'm grabbing that by the horns and I am running with it. And all these things that I am learning that I can use to help save lives. And am I like boldly dreaming when I say that? I'm gonna say no.
We can bring our own experience to the table. That's adult learning, right? And that's how you get people engaged. You gotta make it relevant.
I will say this, it does work. This actually does work, and I guess I'm an example that it does work.
We have to do something. We have to train our own. We have to start advocating for people with all different levels of education.
Behavioral health workers have put themselves on the front line of facing up to a growing challenge. It will benefit all of us to make sure that they feel fully supported.
If you want to be part of something that matters, like really matters, it's the most fast-tracked, holistic way to get your license and get a career. Not just a job, a career. And we need you.